Hello and welcome to our first ever Embraer Health and Social Care Partnership podcast. I'm Rachel and I work within the Communications and Engagement team, and I'm joined here today with Rhiannon Virgo, Project Manager for 3 Conversations, and Jan Stewart, South East Locality 3C's Innovation Team 1. How are you both?
We're fine.
Fine, thank you, Rachel.
Good, thanks for joining me today. So we're going to be chatting about our 3 Conversations approach, which are a key part of our strategic ambitions, which we aim to deliver over the course of 3 years. Rhiannon, I'm going to come to you first, if that's all right. We've heard a lot about the 3 Conversations over the last 2 years. Can you give us a little breakdown and explain a bit more to some of us who may not know about the 3Cs? So basically, what are they?
Okay, so 3 Conversations it's a strengths-based approach, and it focuses on getting to know the person you're working with really, really well and building up a great relationship with them. And it's got a lot to do with the capabilities of the people that we work with and their families and the communities that they live in. And what we want to do is organise our resources around those things.
Yeah, and I can add to that. In recent years, health and social care has been dominated by assessments, triage, screening, referrals, actually red tape and bureaucracy, really, which has led to long waiting lists, staff and people were feeling lost in the system. 3Cs tries to get rid of or significantly reduce all of that. It makes things simpler, where we trust staff, minimise the paperwork and free up time and resources to focus on the important things, the people.
Yeah, absolutely. I agree with that, Jan. It really focuses us on making things better, better for staff, better for budgets, and most importantly, better for the people that we support, as Jan says. 3 Conversations is the brainchild of a guy called Sam Newman, who runs Partners for Change. And he's supported 40-odd councils right across England to implement 3 Conversations. So we're the first Scottish healthcare partnership that they've worked with. But there's now a lot of interest from other Scottish authorities, so I think we're maybe riding the crest of the wave at the moment, and others will be coming along behind us.
Okay, maybe it's a good time to explain a little bit about the 3 different types of conversations. So the 3 Cs refers to the 3 types of conversations you might have with someone. Conversation 1 is about getting to know the person, listening to them and connecting them to maybe their own personal community assets. It might involve a bit of supportive work. We may provide them with some equipment, for example, that will keep them independent at home. Conversation 1 is about keeping people involved in their community and the society, making sure they aren't lonely and that they're managing to do the things that are important to them, like going to church or local groups or meeting friends. Conversation 2 is about dealing with any crisis situations that come up and sticking to them like glue when this happens. Then making a plan to deal with the crisis and then work through it. And finally, the conversation 3, that's the final conversation, and it's about building a good life when, despite the connections that may have been made, the person still needs a bit more formal support from us.
That's great. So from what I gather, it's more about revolutionising what we do to create better outcomes for everyone, ensure that we're future fit. So that all sounds really great. Can you tell me a bit more about why the Embraer Health and Social Care Partnership decided to adopt the 3C model?
There were quite a few reasons for that. So probably the first one was the Care Inspectorate report in 2018. Wasn't a great report in a lot of ways. Highlighted a number of areas that they thought we ought to improve. So some of the things they wanted us to improve were focusing on good practice, systems and processes, doing more preventative and transformative early intervention type work, along with that, quite a number of other things. And what we decided was that as a partnership, we needed a really transformative approach to address some of this stuff. We didn't want to just tinker around the edges. We wanted to pretty much rip up what we were doing and start again from scratch. The executive management team had heard of the work that Partners for Change were doing in England, and they were really struck by the success that it had had there. And in particular, it was the principles that underpin it that really appealed. They really aligned with what the partnership wanted to do and the sort of values that we were beginning to set at that stage. So a few conversations were had, and the result was that the partnership decided to go with 3 conversations and to actually build it right into the strategic plan, and make it the proper pillars of the strategic plan, and so we would be sticking to it for at least the next few years. And it's probably worth saying that 3 conversations is like part of that strategic plan and the transformation programme that came out of that work. We're trying to build a healthcare partnership that works for everybody in Edinburgh, and 3 conversations is a big part of it, but it's not the only thing that's going on.
That all sounds really interesting. And one of the things I hear people talking about a lot with the 3 Cs is innovation sites. Rhiannon, can you explain a bit more about what they are?
Yeah, innovation sites are a small team that decides to adopt the 3 conversations approach and test it out. It's usually about 10 to 12 people, so quite often it's only part of a bigger existing team. So we're not trying to say that you have to put your whole team through it. It's more about having a small group of people, which is a good size for working on something like this. The first thing we ask teams to do is work out who they will be supporting. Is it all of the current people that they're supporting, or is it only part of them? And there's lots of ways to choose. Some teams have picked a geographical area. Some people have picked people on a waiting list, and some have chosen to people that have contacted us on a particular day of the week, which is a bit of a weird one, but it worked pretty well. And the principle is that the amount of work that they take on has to be proportionate to the size of the team, so that if they were part of a big team, the people left behind aren't picking up more work than they should have done. We want to make sure that the innovation site takes their fair share.
Yeah. And adding on to that, Rhiannon, then the team will start to think about how they'll do things differently. Are they trying to prove that they can get rid of a wait list or handle people without needing lengthy screening processes, for example? There have been a lot of different things trialled by the different teams. We've also got some rules. We ask teams to have daily huddles. These huddles are really important. Teams use them to discuss the work that's coming in, allow people to volunteer to pick up different bits of work in a collaborative way, and it gives them a chance to discuss what's going on and any problems that anyone's run into, and to make decisions collectively about how to handle them.
That's it, and the huddles are only one of the things. So Partners for Change will support all new sites with a weekly reflective practice session. Reflective practice is really one of the cornerstones of this approach. It gives workers time to think about what they've been working on and discuss things in depth with their colleagues.
That sounds great. Jan, you started one of the very first innovation sites within the Embraer Health and Social Care Partnership. I just wondered if you could tell us a bit about that.
Yeah, Rachel, yes. In South East locality, we started the first innovation site back in July 2019. At that time, we worked within a specific patch in the locality, and our criteria at the start was only working with those people who didn't have any existing services. Our team was set up and managed by myself, a senior occupational therapist, and 10 staff, a mixture of social workers, occupational therapists, and community care assistants. They'd all actually chosen to be part of working in this new approach and were involved at every step of its implementation. The team's first week was actually spent walking the locality and finding out what local groups were out there. Then they all came back and shared their findings with the team. And at that point, we even had a map in the office and would mark out where they all were. I guess it was quite important at the beginning that the team had to gain a better understanding of the approach and the paperwork. However, with the support of the Partners for Change, it made the transition to this way of working happen almost naturally. Staff reported that they felt they were going back to working within their core values, a real holistic approach, and using meaningful activity to affect change in people's lives. With a management buy-in, they were actually given the autonomy to work in this way. They liked working collaboratively, no handoffs or referring on, and people were seen quickly and they were a single point of contact. I guess it was challenging from many aspects, but also very rewarding as we continued to see people quickly and we still had no waiting lists. After 9 weeks, we were not only expanded to take on another patch within the locality, but then at that point we accepted all the criteria. This made a significant change in the amount of work coming into the team. However, again, the team were amazing and rose to the challenge with absolutely no qualms whatsoever. One of the most valuable parts of this approach was adopting the huddles each morning. This was where we discussed the people who'd come to the team, Was any worker seeing anyone else in that area, or did somebody know the person previously? The huddle also gave a platform to discuss the complex and stressful situations. Once a week, we'd also have an extended huddle where we could talk about our stories of difference. And one of the major benefits to working in this way was not only connecting people to other colleagues or other disciplines without the person being referred on or sitting on a lengthy waiting list, but also the benefits of this was super effective when staff went on holiday or even when they were off sick, as we felt the team owned the people and everyone worked collaboratively.
That all sounds really positive, and it just goes to show about all the great teamwork of all of our colleagues across the partnership. I'm sure you're already seeing some really positive results. Can you give us a number? What sort of results are you starting to see?
Yeah, we're up to 11 live sites. So we had one new site go live today, so that was South East Home Care. And that's well over 100 workers. And we've worked with all 4 localities. And we've got teams in some of the specialist services as well, like the Edinburgh Community Rehab and Support Services, Young Adults with a Disability, and the Residential Review team. And we've got an ambitious plan to bring on 3 North East sites by the end of June. Things are going really well in North East, and they really want to come along with this.
And I suppose I can add to that, Rhiannon, that we've reduced the time it takes to respond to people. We used to take an average of 40 days to respond to people, and our average in April was half a day, which is exceptionally impressive. 65% of people we see don't need to have any sort of long-term care. However, this has been affected by COVID, and there aren't the same community options out there as there used to be when we first started.
But it's still a pretty good number. In the localities, we're up to approximately 35% of staff using this approach in what used to be called assessment and care management, that kind of mainstream social work and OT, CCA type work. But in some localities, the number's a lot higher. In the southeast, they're up to above 70% of staff. And when northeast come on in June, they're looking to have 100% of their mainstream hub and cluster workers come on and work in this way. So that'll make a big difference.
That all sounds really great. So you've said a lot about the importance of working with people differently. Can you give me some examples of how well that's worked?
We're starting to do a bit of survey work there, people we've been working with, and we've got some really great feedback. Jan's been doing some of this, so I'm going to ask her to tell us the feedback.
Yeah, thanks, Rhiannon. I guess it's not about the money all the time, it's about the outcome for the person. An example of one that we had where we had a big saving and no cost would be the graded approach that one of our team had with 4 people, by assisting them to access a tea dance in the local church. None of these people wanted to attend a traditional day centre, and if handed a leaflet or signposted to a tea dance, they may not have even bothered going. Whereas the worker connected them all, and after a couple of weeks, they were all making their own way there and enjoying the community resource. I guess the outcome for them was purpose, interaction with others, companionship and mobilising. And I guess we can't deny the savings to the department could have been around £100 a week per person. Another example of a good outcome and a small cost was when a young lady who was affected in her daily life by her mental health issues made contact as she needed assistance prompting to take her meds and get dressed and eat in time. Through a good conversation, the worker established that she had really good skills the use of her smartphone. So rather than a package of care being provided, a one-off purchase of an Alexa for around £60, programmed with reminders, meant that she remained independent with those tasks at home herself. I guess I could go on of many stories of difference, but I won't do that just now. I'll save that for another podcast.
That all sounds amazing, and the importance of technology, that can't be understated. So, that's just amazing. But of course, nothing ever really runs smoothly, does it? So, what sort of challenges did you face with the 3 conversations?
Oh, there have been a few. So one main challenge was around whether the approach will work for health as well as for social care teams. We've had loads of questions about that one. And what I would say is it absolutely can work in health. We're starting to work with some health colleagues in the Astley Ainsley Hospital and some in the mental health teams, and we're going to try and get some innovation sites going there. And we've also had interest from the district nurses. So we're all working to the same set of principles and values, whether we're council or NHS. Person-centred care is something that everybody wants to do and is kind of core to everyone. So that's why we think it would work for both.
Yeah, and Rhiannon, I guess there have been some staff who haven't enjoyed the new approach, although not very many, I'm pleased to say. Some people who were the biggest critics at the beginning have now switched to recommending us to other teams, which is a fabulous positive.
That's true. That's absolutely true. There's been headaches with recording as well. What gets written where, that's a bigger problem than you think it ought to be. We've worked with the Swift team to sort out a lot of these, but it did take quite a lot of time as well.
And speaking of challenges, this past year and a half has been, a difficult year to say the least. What challenges have you faced with the 3Cs since COVID started?
Oh, Rachel, it definitely has been a challenging year. Home working, remote access, Teams meetings, not to mention the homeschooling for some workers and resources shutting down. Yes, at the beginning of the pandemic, some teams have had staff employed to care homes or other parts of the partnership to help out in the critical situations where more staff were needed. So we kind of lost some staff to those vital services that needed them. One of the most important things was still having the morning huddles to check how staff were, and in particular, their emotional resilience at the time, the times that were very difficult.
Yeah, new sites have had to start completely virtually, so all the support had to take place through Microsoft Teams, and there's pros and cons to that. It's easier to get everyone round a table when nobody's travelling across Edinburgh to get to a meeting room in a particular building and worry about parking and all the rest of it, but it is harder to build up a relationship with a new team when you don't see anyone face to face and all you can see is maybe a dot on a screen some of the time. However, we've had 5 new teams start since COVID began. Started off with one of the Longston sites, and then I think 3 of the localities have had a new team go in that time, and they've been brilliant. They've absolutely put in the effort. They've been really willing to take that leap of faith and go, is this the right time to do it? And I can see a lot of people going, COVID is not the time to do that, but they absolutely did it, and they did an absolutely brilliant job. And I'm really, really proud of those guys, because it was not an easy time to go live.
Yeah, definitely. And I think we can all say we felt the effects of MS Teams meetings. So, it's great to hear that, people are working through these challenges. So what comes next for you guys? What's on the horizon?
Well, Rachel, I'm about to start a full-time role as the practice lead for 3 conversations. So that's very exciting when I'm into post. And we're expanding as much as we can. I guess Rhiannon's touched on that. Home care site started today, and we've got the Northeast locality coming on board soon. And Southwest, well, they've asked to expand too. So, it's all opening up and mobilising. It's excellent.
There is, and I think our biggest thing is trying to get into some of the areas of the partnership that we've not worked with yet. So as I mentioned earlier, there's the Astley Ainsley, there's mental health, there's district nursing. But yeah, we really, really want to try and work with people that we've not touched yet. And we know that there's loads of the partnership that 3 Conversations hasn't come into yet. So if anybody out there is listening to us and you think this sounds interesting, then give me or Jan a shout and we'll talk you through it. It would be lovely to hear from you.
Oh, that's great. I think that's all we've got time for today. Thanks so much for joining me. I hope everyone found that interesting. I know that I did. That was our first ever partnership podcast, so on the 3 Conversations, so hopefully there's more to come. It's been great speaking with you both and hearing about all the amazing work that's going on in working towards a more caring, healthier and safer Edinburgh. As I say, we're hopeful to bring more of these podcasts soon, so keep your eyes peeled in our colleague news articles, as well as our Edinburgh Health and Social Care Partnership website. Thanks for joining.
Thank you. Bye.
Thank you. Bye.